Top doctors here in North Texas held discussions about including vaccination status when admitting patients if hospitals become too overwhelmed. It would only apply to critical scenarios if hospitals fully run out of staffed beds or are on the brink of collapse. Under those conditions, considerations like underlying health conditions and age would apply. Doctors considered whether vaccination status should also be included. Fox 4 obtained an internal memo about the discussions, and with more on that, let's go to Stephen Dial. Stephen.
Heather, this discussion was members of a task force that basically give guidelines to hospitals when they reach mass occupancy capacity, when they last resort mass capacity. And so the discussion about vaccination status is just that for now, a discussion. COVID patient numbers in North Texas are closing in on 3,000 people, most of which are not vaccinated. There are just 62 staffed ICU beds available in North Texas. The state sent in reinforcements to hospitals this week as pre-existing staff shortages were made worse by the latest surge.
What do we have that's left? How much wiggle room do we have? There was a day last week we were down to 12 beds in Dallas County. Those are ominous numbers.
Thursday, Fox 4 obtained a memo sent to members from the North Texas Mass Critical Care Task Force. The independent group provides hospitals with medical care guidelines. It summarized a discussion about a possible new guideline if things get worse and hospitals run out of beds. One of the guidelines discussed whether to factor in vaccination status if doctors had to choose which patient to admit. Dr. Mark Casanova with the Dallas County Medical Society is a member of the task force.
As part of our deliberation, the question of vaccine status was raised.
Part of the memo said, quote, many are understandably angry and frustrated with the unvaccinated, but triage must remain grounded upon likelihood of survival. Healthcare professionals should continue to honor duties of care and compassion. Dr. Casanova says ethically, doctors cannot discriminate based on vaccination status. He says in a situation where one bed is left, doctors have to make a decision based on multiple health factors to see if a patient would survive treatment. The discussion was whether vaccination status would also be on the list.
If we find ourselves in a situation where our capacity to provide high-level, effective, life-sustaining therapies is overwhelmed by the number of patients under our roof, and we do not have the ability to transfer to other hospitals, other care settings, we will have to do an individualized assessment of each patient, how they're doing clinically, and answer the question as to their likelihood of survival to discharge.
The memo also reiterated that vaccination significantly lowers the risk for severe illness and death.
We are doing all we can to avoid the worst case scenario. When you hear healthcare professionals plead with the public to get vaccinated and to wear masks, it's for a reason. It's for what we're potentially facing in North Texas in the near future, unless we can stem the tide.
And as we've been reporting for weeks, the hospitals are dealing with staffing shortages. And today, Governor Abbott announced that he's doubling the number of traveling staff that will go to hospitals in our area and across the state, raising that number from 2,500 to 5,000 by next week.